Knock, knock, knock.
Come in.
Hi, my name is Annette, and I am the student nurse to take care of you. I have an order here to do a head-to-toe assessment on you before your discharge, but first I need your name and date of birth, please.
Ruth Brand, January 12th, 1934.
Perfect, thank you, Ruth. Do you have any questions about what a head-to-toe assessment is? Okay, so I'm going to explain it to you, and it should take about 10 to 15 minutes. We're going to just go ahead and check overall how you're doing,
Okay.
and I'll just be listening to your heart and your lungs, checking different things on your body. And so while I'm doing the assessment, when I walk in, I can actually check the patient's appearance, grooming, and hygiene. While I'm talking to the patient, I'm checking the speech and level of consciousness. I can also sense, or not sense, but tell their mood and thought process. And while I'm going through and performing the assessment, I can check the integumentary system for color, skin rashes, possible edema that's in throughout the body, temperature, skin color, mobility, range of motion, and balance. So could you actually tell me what today's date is, who the president is, and where you're at?
August 15th, 2016. I'm in the hospital, and the president is Barack Obama.
Okay, perfect. I'm going to go ahead and raise your bed to my level so that I can perform the assessment. I'd also be checking the patient's elevation of their head and how many pillows the patient is using. Okay, so first I'm going to go ahead and start with the head. We'll start with the scalp and then we'll move down to the toes. So if you could just please sit up for me. And I'm going to put gloves on. Some margins. And I've already washed my hands. Okay, so I'm going to go ahead and check the scalp, and I'm going to check for color, rashes, possible lesions, dryness. Have you had any dizziness lately?
No.
Okay. Difficulty remembering things?
No.
Okay. Have you noticed, I'm going to have you look at me. Have you noticed any itchiness on your scalp at all?
No.
Okay. Perfect. And then I'm going to check behind the ears. If the patient had a nasal cannula, there could be possible irritation behind the ears. I'm going to check the ears. Have you had any trouble hearing, difficulty hearing lately? Any ringing in your ears?
No.
Okay. Have you had any discharge?
No.
Anything coming out of your ears, liquid, fluid?
No.
Excessive earwax?
No.
Okay. And so while the patient's looking at me, I can go ahead and check the eyes next. So we're going to check for pupils, equal, reactive, round, to accommodation. And we're going to check vision. Have you had any blurriness lately, double vision, difficulty seeing?
No.
Okay. Difficulty seeing at night?
No.
Okay. And I'll check the pupils to see the reaction. And so if you could just go ahead and follow my pen light, please. Checking for tracking, which so far is really good. Okay, and I'm going to go ahead and shine a light in your eyes, and this is to check the reaction. So if you could just go ahead and look at my nose, please. Perfect. Thank you. Okay, I would also check for the conjunctiva in the eyes, making sure that there isn't any irritation, nothing, no irregular fluids, that they are, pink and red and moist. And so then I'll go on to the nose, and I'm just going to shine the light up into your nose, checking for mucous membranes, making sure that they're pink and moist. Okay, perfect. And then I'm gonna check the mouth. So I'll check the lips and inside the mouth to make sure that the mucous membranes are moist and that they're pink and that there aren't any lesions. If you could open your mouth and say ah. Okay, checking the tongue, the teeth. Your teeth. Oh, there you go. Thank you. Perfect. Okay, and then I can go ahead and I can check the lymph nodes on the neck and moving down. Okay, and then when I go down to the arms, I can check. Can you feel this?
Yes.
Me touching?
Yes.
Checking temperature as well. Checking capillary fills on both sides of the arm. Checking bilateral radial pulses. They're both strong and good. Have you noticed any tingling in the hands or any numbness?
No.
Okay. Perfect. Okay, and I'm going to go ahead and have you squeeze my hands. This way I can check for strength in the hands. Good job. Okay, and then next I'm going to move on to the lungs, and I'll check back and forth and then from apex to base. And I grab a alcohol pad and wipe my stethoscope off. Now I'll just need for you to take deep breaths in and out for me. So I'm going to go under your shirt. This way you can get clear sounds. Take a deep breath in for me and out. And out again. And in. And out. And again. And out. In again and out. Then I'll check both sides bilaterally, in and out. Deep breath in and out. Deep breath in and out. And while I'm doing this, I'm also checking the skin in and out, out, in, out, in, out, Now for the basic head to toe assessment, you would have them just breathe in, listen to the apex to the base, but if they had like pneumonia or something like that going on, then you would listen to all of the areas in the lungs. And then I take an alcohol pad and wipe my stethoscope off, and then we'd be good for that part. Have you had any difficulty breathing, shortness of breath, excessive coughing? Have you been coughing anything up?
No.
Okay. So, like I said, again, just checking the skin while we're doing the assessment, noticing if there's any lesions, breakage, rashes, or anything like that, discoloration. Next, I'm going to go ahead and listen to your heart, and I'll listen to the apical pulse. I'm going to go under your shirt again, and I've listened for a full minute. Nice and strong. Have you had any shortness of breath walking up and down the stairs? Any pain?
No.
Okay. No chest pain? No pain in your back? Okay. Again, wipe my stethoscope off with alcohol. And then I'll move on to the abdomen. So I'm going to go ahead and lower your bed, your head of your bed, so it's flat. First, you'll want to inspect it. You'll expect for symmetry, if there's any distension while you're palpating, if there's any pain. So, and then you can also check for color. I'm going to lift your shirt up. So first you inspect, then you're going to auscultate. So listen to the abdomen, and you'll listen until you hear sounds. If you don't hear sounds, then you'll need to start listening for the full 5 minutes to make sure that there is some movement and that there isn't a blockage. So I'm going to touch. Perfect. When's the last time you had gone to the bathroom, like number 2?
Last night.
Okay. Let me know if there's any pain upon touching. Doing okay so far? Okay. And you're looking for a feeling if there's any lumps or bumps, any pain, and then let me know if there's any pain when I let go.
No.
Okay. And then you can also percuss. Sounds good. Okay. Then you'll also check for bladder distension. How often do you go to the bathroom? Go pee?
About 3-4 times a day.
Okay, so you're getting enough fluids then? Okay, you're drinking lots of water? Okay, and then do you have any pain? Do you have any frequency or urgency to go to the bathroom?
No.
Okay, do you notice anything when you go to the bathroom? Is there any different colors or, okay. No other fluids? All right. And then also I forgot too, when you're up here at the chest, you can check for the skin tuber. And that looks good. He has enough hydration. Okay, so now I'm gonna go down to the legs. I'm gonna bring your blanket down. So I'm going to ask the patient, can you feel me touching?
Yes.
Okay. And if the patient once the patient had a gown on, you check for temperature. Also noting for any edema in the extremities, you would do that also with the hands. Check cap refills on both feet and then bilateral pedal pulses. And check those for a full minute. Again, noticing if there's any rashes, discoloration of the skin, any lesions possibly anywhere. So then you'll check for the Homan sign. Just relax your legs, please. Is there any pain when I push up?
No.
So that's a negative. Can you push against my feet or my hands? All right. And then push again. Strength is good. So you're checking for strength, range of motion, and mobility. So what I'm going to do is go ahead and I'm going to lower the bed, and then I'm going to have you sit up. And you'll put it in the lowest position so it's safe. If you could please sit up for me, thank you, and then turn facing me. So this way I'm able to check and see the mobility, strength, and range of motion in the patient when they're moving around in bed and having to sit up. So I can check and see if there's any difficulty in moving hands or arms, any limited ability, but that looks good. Okay, so I'm gonna have you stand up and walk 10 feet and then walk back. This way I can check balance and coordination. But first I need to have you push against my hands. And push again. Good. So you can check the strength of the legs that way as well. So I'll have you get up and walk. Staying close behind. Okay, and come back. Okay, perfect. And you can go ahead and get comfortable with that again. So do you have any dizziness when you stand up or sit up? I should have asked you that a little bit earlier.
No.
Okay. Do you want your head to veer bed up?
Yes.
Okay. So do you have any other questions for me?
No.
Okay, perfect. Well, you did awesome. Thank you. Okay, so I go ahead and wash my hands. Do you need anything to drink?
Tillman.
Okay, I can't get you anything to read, all right. And then, get the call light for the patient. There you go. Let us know if you need anything. Go ahead and push that button. And, I'll be back to check on you in about 30 minutes. Also, before I got started with the head to toe assessment, I should have asked the patient if they needed to use the restroom. So I would have done that as well. All right, well, thank you so very much. Have a good one.
You're welcome. You too.
Bye.